Is this not the most like delicious thing you've ever seen in your life? It's actually not coffee. This is a dirty Diet Coke. So good. Alrighty, welcome back to the channel, everybody. Today we are discussing my birth plan. If you've never seen my face before, my name is Marla. I'm 30 years old. I'm about to have my second baby. You can't see anything. So a couple of disclaimers, obviously. Just because I want to do something a certain way or I feel it is right for me is not saying that, you know, the opposite of that is wrong. If you want to do something totally different, you are not wrong. Just like I'm not wrong in the way I want to bring life into this world, because that is no small thing. A few things that have shaped my decisions is majorly my first birth. I just know what I don't want to do or what I do want to do. And then also I am a nurse, not labor and delivery, so I would never claim to, you know, have all of that figured out. But just some things I've seen and my experience in the medical field has also shaped a lot of my decisions. So let's get into it. I have my little notebook of everything here. I also opened this video up to kind of like a Q&A over on my Instagram. So I'm just gonna answer kind of things or have some of those questions riddled throughout this video. If I either didn't get to your question or if, you know, watching this has sparked a question, please comment any of those questions, because I know I'm gonna miss stuff and this will be an ongoing conversation because there's just so much you could talk about. And there's even things within here that I could make like a whole video on. So I'm open to answering everything. I am like the most open book, sometimes like to a fault. But anyway, let's get into the birth plan. But also let's define what birth plan means to me. So I am not saying that I'm going in there with my birth team and I'm saying, okay, step one's gonna be this, step two's gonna be this. I'm gonna be, you know, pissed and devastated if it doesn't happen this way. Like, that's not what I'm saying. It's just, I didn't like this last time, so let's do this. Or if this happens, let's do this. Like, it's just a whole lot of like well thought out ifs. A little bit of history on me, which is gonna be important, is I will be induced no matter what. I have a history of lupus, which is an autoimmune disease. With my first pregnancy, I had cholestasis at the end, which is something that can occur in pregnancy, and it increases your risk of stillborn within the last couple of weeks. So there's a possibility that cholestasis could resurface again. It hasn't yet, and I'm pretty close to the end, but just to be on the safe side, my OB has said you will not be getting anywhere near 40 weeks. So I will be either 37 or 38 weeks. I also started leaking fluid a little bit at the end of my first pregnancy, so that was another reason why I was induced that time. We've all just known that from the start of this pregnancy. So with my first birth, I was induced with something called a balloon catheter, and it is the most archaic, barbaric method of induction, and I refuse to do it again. I had my OB all throughout my pregnancy, and then I ended up having to just have who was on call at the time. So it wasn't him at the end. So now I have that same OB from before who I love and is great, but I told him, for this induction, if you even mention a balloon catheter, I will light this room on fire. And so he was like,
okay, no problem, we won't do a balloon.
And that's a perfect example of like, there are some women that have used the balloon and say it wasn't that bad, but the vast majority of women I've heard that have had it say it's just awful. So if you've never heard of it, it is similar to a catheter you would get for your bladder for your urine, but obviously instead this is to induce labor. So it's inserted, and then there's a balloon that's inflated in between your cervix and I guess what would be like your amniotic sac, and that's inflated on your cervix, and then there's another balloon inflated underneath your cervix, and so the counter pressure is supposed to tell your cervix, hey, let's start doing something. So some OBs like it because it is a medication-free induction method. But it is just so painful and so uncomfortable, and it didn't work for me. It didn't make me dilate or induce my labor at all. So the idea is it's supposed to just fall out after a certain amount of time, meaning you've dilated enough that those balloons fall through. Well, mine never did. And when my OB came, or the OB that was on call came to check, he actually ripped it out. So yeah, I'm just like not doing that ever again. So my preferred induction method this time around is going to be something called Cytotec. So it is a pill that just tells your body to dilate. And typically you can do 2 doses of that. I'm not sure about like the time and spacing in between, but and then after that, that's supposed to kickstart things and then either get you like all the way, or then the next would be Pitocin. So to discuss Pitocin, I don't love it. I see the value and the importance of it, but I hated Pitocin contractions. They are not the same as natural contractions. I was waiting for, you know, the break, the like, oh, it's a contraction, ouch, 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 and then, oh, I can breathe and talk and move until the next one. That didn't happen for me. My Pitocin contractions were just started, and then that was it. So if I can do without Pitocin, that would be great. I'm not expecting that to happen given how long and how resistant my body was to, you know, moving forward the first time, but we'll see. I also found out just this week in an appointment that I do have presence of group B strep on my GVS swab. So that will mean that I will get antibiotics infused either, I think, ideally before your water breaks and after. Probably the best case scenario is if I can get 2 doses 4 hours apart. So I know that going in that that's going to happen. I'm also not like, I don't have an issue with IVs. If you want to start an IV the second I get there or like have it in, that doesn't bother me. That's fine. I also have no interest in a vaginal birth with a breech baby. If by some miracle this baby flips around, which I don't think so because it's buried its head so far into my pelvis, I will just opt for a C-section. I'm not interested in doing a breech birth. Pedaling back a little bit, part of my birth plan is even just getting there, sitting down, and having this discussion with my birth team. I feel like when I think back to my first labor, I just kind of went in and I just felt like at the mercy of the people in the room and was like, okay, like do your thing. But like now knowing what I know and knowing what I like and what I don't like, I am going to express, you know, those things to my team. So in that discussion, one of the things that I'll be letting them know is that we are banking cord blood and cord tissue. So just making sure everybody, you know, is up to date on how that works. So the kit that we have, you know, comes with all those instructions and everything. So it'd be nice to run through that like before the real stuff gets going. I will also be letting my team know that the last time I got an epidural, my blood pressure bottomed out immediately and like severely. It was an awful feeling. It feels like you're fainting, but just like worse. It's this like doomsday, I feel like I'm gonna die kind of feeling. So I'll definitely be letting them know, hey, that happened last time. So there's some things I can do to kind of either prevent it or just be prepared. So we'll be having that discussion. I also got insanely nauseous when my epidural started. Not sure if it was due to the epidural or because of my blood pressure bottoming out and like fainting. So I'll probably tell them like, can you have some Zofran ready? Like some like anti-nausea meds, just because like that feeling is so awful. Like I'm about to faint, about to pass out, and I'm about to puke. Like it's awful. So I just want to be ready in that moment. And then speaking of the epidural, I got mine what felt pretty early last time because the Pitocin was just like so intense. So I got an epidural around 4 centimeters, which I think is kind of like the bare minimum you have to be to get an epidural. But it actually worked out okay because then I had an epidural before I actually had my water broken, which was great. So I would kind of like to do that again if we can. Because once your water breaks, like stuff's getting real. So if we can plan and prep for the epidural before breaking the water, wonderful. I mean, it goes without saying too that like I'm getting an epidural. If I've said that enough, that's part of my birth plan. One of the best pieces of advice I ever received when it came to an epidural and just like birth in general was, if you know you want an epidural, ask for it and say, okay, epidural time, at least 30 minutes before you think you're going to be just like out of your mind desperate for it. Because I feel like a lot of women think like, okay, I'll see how long I can go. I'll go for as long as I can without it. And then I'll like throw up the towel and be like, hey, epidural. But then now you have to wait, especially, you know, our hospital, our anesthesiologists are just on call at night because it's a smaller facility. So I know to ask for it, you know, okay, this is really, really rough right now. If this gets worse, I'm going to be losing my mind. So I'm going to ask, you know, before we get there. And even if you are at a larger facility, sometimes they're in surgery or just like busy in general or doing another epidural, like asking a little bit ahead of time is definitely key. I've seen a lot of mixed information lately about labor positions with epidurals and different things like that. The facility I am laboring at, they, you know, maybe certain larger facilities with like special epidurals or something can offer different labor positions than like just on your back. Obviously, that's not the ideal labor position, but with an epidural, you're definitely limited. And it depends on your epidural too. Like I was really fortunate in that if somebody said like, move your leg here, I could. Like it felt really weird. And sometimes I'd have to like help it with my hand or somebody else would help it. But then there are some people that are like, I got nothing. Like there is nothing below this waist. And there's no way you can labor in a different position than on the bed, on your back, maybe on your side. And so I just know like that's my labor position, and I know, you know, how epidurals feel and how they work, and like there's unfortunately there's really no other way to labor if you get an epidural, and that's fine. The OB that I had the first time also was a little bit too like eager, a little bit too quick to just like jump to the next step sometimes. And so I for sure will be having, you know, a different OB like for this birth. It'll be the OB that I've had all along. And he is a little bit more, you know, relax, let mom push, like don't jump straight to the forceps, which is what my first labor, I pushed, I think like 2-3 times and he was picking up forceps. And me and nurses were like, whoa, dude, like relax. And so that'll be a conversation too, is like, you're not touching forceps, episiotomy, vacuum, anything of that sort, unless baby is desatting. Like, unless there's decelerations, unless somebody, me or baby, is in major issue, you're not going anywhere near those tools. Because to be perfectly honest with you, I would almost rather just take me down for a stat C-section than try the forceps, do an episiotomy, try all of that, maybe that fail, and then go for a C-section anyway. Like I'm not doing both. So you can pick one. I don't foresee that happening because I carry my baby super, super, super low. And so they're basically there already. It's just a matter of like getting the head over like the pubic bone. And then we're kind of, you know, in the home stretch. But yeah, no forceps unless absolutely necessary. Something that I thought was so great and I think helped me so much in minimizing tearing was one of the nurses that was on, I actually like know and was friends with. And so when I was pushing, she would do perineal massage. And I think that actually helped a lot. And so her and I talked about that and I was like, yeah, so, you know, when you're definitely on for my second labor, you can do that again, right? And she said, you know, typically what she sees is that it's really beneficial for first-time moms, first-time laborers, and then typically the body has a bit of that same stretch, a bit of, you know, muscle memory, and doesn't need it as much, but we'll see. I definitely think that helped a lot. Okay, so baby is out, now what? So last time baby came out, placenta came out, like no problem. And I think she had to go over to the table really, really quick just to make sure her breathing and mucus and like all that stuff was taken care of and good. And then I definitely want, her on my chest skin to skin as fast as possible. But something that I do want to let them know of ahead of time is if I need stitches, to either keep my epidural running for an extra couple minutes or give me injection of lidocaine to the site, so freezing, before the epidural is worn off, and then do your stitches. Last time I had a 2nd degree tear, and so he was doing stitches, and pretty immediately after, I could feel it. It was obviously very painful. And so then he gave me an injection of lidocaine, which I could feel. So this time I want to avoid the feeling of any of that if I have any tearing. So either inject your lidocaine before the epidural is wearing off, or keep that epidural on for like an extra couple of minutes, inject the lidocaine, turn it off, and do what you gotta do. Okay, so baby is out. If they feel there is enough cord blood in the umbilical cord and the placenta to do a little bit of delayed clamping, I'm okay with that, but my priority is banking cord blood. So if they feel there's not enough, then I'm fine to just clamp. Obviously, my husband is going to cut the cord, and then they collect the tissue and the cord blood to send off. I am open to all blood products, all measures necessary. If, say, I'm hemorrhaging or if there's anything, any complications going on, I'm open to all measures to, save myself and baby. I am also pro vitamin K. Baby will be getting that injection 1,000%. I'm kind of indifferent about the erythromycin eye drops. I don't feel they're necessary for my babies, and so I'll probably be skipping those. I also like to delay a full submersion bath. Actually, best practice now is to delay that full bath, of washing off of the vernix, which is kind of like the cheese stuff they're covered in when they come out. So obviously rubbing off as much as you can of that, but I am going to delay a full submersion bath just because there is so much benefit to that layer of vernix when it comes to just extra lubrication and moisturizing of the skin. There's, studies to prove that it does help long term for a baby kiddo and once they're an adult when it comes to skin diseases and disorders like eczema, psoriasis, things like that. And it's not that big of a deal. It's just wait a little bit for a full bath. I'm definitely open to kind of a sponge bath kind of thing, just making baby presentable, cute, comfortable, all that kind of stuff, but without the full tub bath. Also, something I love advising and telling moms, because I got this advice and it was great, was to either bring some coconut oil or Vaseline and put that right on their booty the second they're out and you're about to, get a diaper on them and dress them all up all cute. Their first couple of poops, it's gonna be something called meconium, and it is going to be like nothing you have ever seen or witnessed before. It is the most tarry, sticky, intense. It's not a liquid, but it's not a solid. I don't know. It's something. So I like putting, coconut oil or Vaseline on the bum because it'll just wipe that off so easily. Otherwise, you're literally dealing with, sticky tar on your baby's butt, which is fine. It's not that big of a deal, but it just makes it easier. I will be breastfeeding and, latching baby as soon as possible. My plan is to either hopefully bring some colostrum vials that I'll be harvesting beforehand. So it would be nice to give some of that as well. We really struggled with jaundice with our first, and she was so jaundiced that she was too tired to feed. And it takes a bit for the milk to come in, all this kind of stuff. So I'm just prepping ahead of time a few things to help make that breastfeeding initial part a little bit easier. If we do have to deal with jaundice again, I will do a little bit of formula because formula pulls out jaundice way faster. And so it's kind of like just getting a head start on it. And then I am hoping to exclusively breastfeed maybe a couple bottles like in between if needed, but that's the goal. So we'll see. I'm open to whatever happens because it's just so often out of your hands a lot of times, but that's the goal. Okay, now on to a bit of a controversial topic that I hesitate to talk about because people are just so heated about it, and it's a perfect example of I'm not saying I'm right and you're wrong. If you want to do the opposite or something totally different, I support you. I love that for you. But if we have a boy, he will be circumcised. My sole reason for that is not aesthetics, like is nothing of that category, but purely what I have seen firsthand as a nurse. And so that has entirely shaped my decision on this. And the two examples I'm referring to is I have seen in our geriatric population, you know, obviously we're short-staffed, we are overtired, we are moving as fast as we can. And in some facilities that I have been in and worked in and seen firsthand, those that are not circumcised have been provided care that makes me nauseous to think about. I have seen, you know, skin not retracted into the correct positioning, and I have seen, you know, worse swelling and infections than you can imagine. Obviously incredibly uncomfortable for the patient. And if they are not able to, you know, adjust things themselves or provide that care for themselves, they are just at the mercy of the person doing it. And I am so not saying this is every long-term care facility or geriatric facility or acute care. Absolutely not. I know there are care providers out there, whether it be PSWs, nurses, care aides, whatever, that are incredible, but I've seen the opposite. And so when I think about, you know, if my son needs to be in one of these facilities, I just never want to think about the possibility of like that happening, especially when I think about, you know, how we can just do this procedure and that possibility is avoided. The other reason for this decision is at where I work with younger populations too. I have seen boys of adolescent ages, not babies, but are grown a bit. And just the way that skin has grown, it's maybe not been provided proper care by parents or not the proper education to the patient itself. And so I have seen, you know, adolescent boys needing circumcisions, and that is way more painful and invasive and traumatic and just like overall awful than to just have it done as a newborn. So those reasons alone is why it is something that we are wanting to do. It's been discussed with my husband. He's on board with that. Like, those reasons alone is why we are doing it. And like I've said, if you don't like that, if you think that's horrific and awful, well, the things I've seen have been horrific and awful. So we can just agree to disagree and everybody's gonna be okay, okay? Everybody's gonna be fine. Okay, moving on from that topic. I've literally dreaded talking about it because I fear ruthless people coming for me. But anyway, moving on. I am undecided on how I feel about visitors. When we had our first, it was still in like the very tail end of COVID. So there were no visitors at the time. And then we also had our first in like the middle of the night. It was almost, she was born at like 11:58 and almost midnight. And so we obviously had her, you know, slept until morning, and then we were about to get a snowstorm. And so typically they'll have you stay 24 hours to do the jaundice check and I think a couple other checks. But we lived like 2 streets over. So they were like, do you just want to go home, try to get ahead of this snowstorm, And then you can come back and do these tests, go home, be comfortable, yada, yada. So we basically left, 6 hours, if that, after she was born. And when I think back, I'm like, oh yeah, I forgot that like people have visitors and, family come in. So I initially was like, no visitors. I loved that. Like, let's not just do that again. But it'll depend on the situation. If baby's born like early in the morning and we're staying a full 24 hours, then like I would love, my parents are going to have our toddler. So I would love for, them to bring her and for our first to meet her sibling. And so I don't know, we'll see. We're going to play it by ear. I'm thinking I am open to my parents and my first coming, and then, let's get home comfortable and then other people can come, but we'll see. I'm not sure. Okay, so I think those are like the main gist of my priorities, things that I liked or didn't like. And yeah, my biggest tip is that if you are doing this for the first time, is to just go in with an open mind. I use the analogy all the time of you can research Thailand and look up every, video and website about Thailand and every restaurant recommendation and all the best beaches, but you can never say you experience it and know it as much as someone who has been there. And so, yeah, my biggest recommendation is just to obviously educate yourself on as much as you want or as little as you want. If it's too overwhelming, then, find a labor and delivery nurse and ask them, questions, or have them give you the key pieces of advice they feel are important. And then maybe just leave it at that. Or if you want to know everything, like at the end of the day, you can look everything up, but doing it is really truly going to be when you know exactly what you're talking about. So just be open-minded and focus your energy. In my opinion, what I think is most important is focus your energy on your headspace, finding ways to de-escalate anxiety within your mind and your body, because that will impact your labor so much. And so really like hone in on those categories rather than like the little specific things that are confusing and overwhelming. Okay, I think that's everything. I'm sure I missed stuff, but like I said, please comment any questions that you have, or even anything you want me to go more in depth on that I just kind of like touched on, and we can totally do that. Because like I said, this will just be an ongoing conversation. Maybe I'll even change my mind about some things or whatever. But yeah, thank you so much for watching and wish me luck in the coming weeks.